Good afternoon, everyone, and good morning to those on the West Coast. So great to have everybody on with us today. We're very excited to present this webinar regarding xerostomia. My name is Dan Fercucci, and I'm with my colleague here, Dr. Himashini Pereira.
Good afternoon.
And thank you so much for joining us for this webinar regarding xerostomia. You and your clinical team are often challenged with diagnosing and treating patients with xerostomia, which, as we know, could have potentially devastating effects on the oral cavity. So the purpose of this webinar is to provide some insight on early detection, comprehensive evaluation, and diagnostic testing and treatment. The team here at UFirst Services believes that an evidence-guided approach to xerostomia management should focus on providing suitable interventions to relieve dry mouth symptoms, reduce oral complications, and improve quality of life. As you know, saliva is produced by 3 pairs of major salivary glands and hundreds of minor salivary glands. The major ones are parotid, sublingual, and submandibular. Of course, the salivary ducts carries the saliva from the glands into the mouth. Small amounts of saliva enter the mouth constantly to keep the mouth moist. The salivary glands really kick into action when we eat or even just think about or smell food. The average person produces 2 to 4 pints of saliva every day. Saliva moistens the mouth. Okay, I have a little bit of difficulty here. So saliva plays a critical role in maintaining not only oral health, but also overall systemic health. Saliva is 98% water, but the remaining 2% contains important substances, including mucus, proteins, minerals, electrolytes, antibacterial compounds, and enzymes. Saliva moistens the mouth for comfort, lubricates as we chew and swallow, and neutralizes harmful acids. Research shows that saliva protects against gum disease, tooth decay, and other oral infections. A thin film of saliva covers teeth and buffers against bacteria, while antimicrobial agents in saliva kill disease-causing bacteria. So one of the key functions of saliva is its remineralization properties, since it contains calcium, phosphorus, and fluoride. Saliva also plays an important role in digestion, thanks to its amylase enzyme. Digestion begins in the mouth when amylase breaks down starch, maltose, and dextrose into smaller molecules. Saliva also plays an important role in maintaining a balanced microbiota. Thus, the multiple functions provided by saliva are essential for proper protection and functioning of the body as a whole and for general health. Would you agree that most of your patients are unaware of this, so they probably underestimate the importance of saliva? The use of systemic medications is one of the most frequently reported causes of xerostomia. More than 500 drugs are known to cause oral dryness, including many of the most prescribed classes of medications, including those for allergies, high blood pressure, asthma, anxiety, and depression. Cancer treatments can cause dry mouth because salivary gland damage is one of the most adverse effects associated with radiation therapy, particularly to the head and neck region. Salivary flow decreases rapidly during the first week of treatment, followed by fibrosis of the salivary glands and permanent loss of secretory capacity, thus dramatically diminishing quality of life. The degree of damage is dependent on the volume of tissue irradiated and the total dose administered. Patients undergoing chemotherapy may also experience transient xerostomia. Dehydration, mouth breathing, and neurological or psychological disorders such as depression or anxiety may add to the perception of oral dryness. Affective mood disorders may affect the autonomic nervous system. And patients with such conditions may experience xerostomia. Also, certain health conditions, such as Sjogren syndrome and diabetes, can also cause dry mouth. It's important for you and your clinical team to become more aware of xerostomia and signs to look for when evaluating patients. The good news is that we now have a list of common signs to look for. For instance, your dental mirror sticks to the patient's tongue and or their buccal mucosa. Patient has frothy saliva. Saliva doesn't pool on the floor of the patient's mouth. Patient's tongue shows generalized, shortened papillae. Patient's oral mucosa, especially their palate, appears glossy. Patient's tongue is lobulated or fissured. Patient has cervical caries on 2 or more teeth, and debris sticks to the patient's teeth or palate. These are just some of the more common signs to look for. Patients with dry mouth often have atrophic oral mucosa, loss of papillae in the tongue and lips that peel and crack. Traumatic lesions may be visible on the buccal mucosa and the lateral borders of the tongue. Dentures may become loose, causing painful ulcerations. Patients also may describe the need to sip fluids, especially when eating, or they may need to drink water when they awaken from sleep. Appropriate evaluation and patient assessment, including a comprehensive medical and dental history, are essential for diagnosing xerostomia. You may want to ask patients questions such as, does the amount of saliva in your patient's mouth seem to be too little? Or ask them, does your mouth feel dry when eating a meal? Or do you sip liquids to aid in swallowing dry food? Or do you have difficulty swallowing? A comprehensive head and neck examination, both extraoral and intraoral, is important in identifying the presence or absence of pooled saliva, as well as providing an initial assessment of the quantity and quality of saliva. Whole saliva is relatively easy to collect in a clinical setting. Although there is only limited evidence regarding the effectiveness of clinical assessment of oral dryness, periodic evaluation of the salivary flow rate provides a tool for monitoring salivary gland function and dry mouth symptoms. Unstimulated whole saliva often is collected by means of a draining or drooling method in which a patient's head is tilted forward and pooled saliva is collected into a sterile container. An unstimulated whole saliva flow rate of less than 0.1 milliliter per minute is suggestive of significant xerostomia. Stimulated whole saliva is collected by challenging the glands through mastication, such as chewing paraffin wax, or through gustatory stimulation using citric acid, followed by expectoration into a collection tube. Stimulated whole saliva flow rates below 0.7 milliliters per minute are within the lower range of output and suggest salivary hypofunction. Laboratory studies, such as complete blood count tests, may be useful when xerostomia is suspected to be related to systemic disease. Autoantibody screening may be helpful when xerostomia is also associated with xerophthalmia, a characteristic of Sjogren syndrome, including serologic results positive for serum anti-nuclear antibodies, rheumatoid factors, or the antibodies specifically anti-SSA or anti-SSB. Minor salivary gland biopsy is a useful diagnostic tool for identifying underlying pathological changes associated with salivary gland dysfunction, especially when you're attempting to identify the underlying etiology of salivary dysfunction as it relates to systemic diseases. Histologic changes are one of the diagnostic criteria used in diagnosis of Sjogren syndrome. Tissue sample are graded according to the level of inflammation within the salivary gland. In most individuals, Candida albicans is part of the normal oral flora, but patients with xerostomia often exhibit recurrent oral candidiasis. A Candida smear or culture may be useful in confirming the presence of candidiasis and the need for antifungal therapy. Treatment planning to alleviate dry mouth symptoms should be tailored to the individual patient. A multidisciplinary model of care for xerostomia should include patient education with the following components. Tell your patient to drink plenty of water because we know dehydration lowers salivary production. They can chew sugar-free gum and suck on sugar-free candy or mints. This can help make more saliva. They must ensure excellent oral hygiene by brushing and flossing every day. You might also want to consider providing them with a prescription strength fluoride toothpaste or fluoride rinse, which could prove to be helpful for them. They could rinse 4 to 6 times a day with a baking soda solution by reduce bacterial acids that cause cavities. They can make this solution at home by using 2 teaspoons of baking soda mixed with 8 ounces of water. Lastly, there are many over-the-counter products that may aid in the moisturizing and lubricating of the oral tissue. These agents are typically available as gels or liquids. And with that, I would like to now turn it over to my colleague, Dr. Hemashini Pereira.
Thank you, Danny. Xerostomia is a condition that's highly prevalent. 1 in 4 people in America suffer with xerostomia. So that's approximately 50 million people that suffer with dry mouth. Our product, Lubricity, was developed by conducting a clinical study to prove the efficacy of the product. 70% of participants in the clinical trial reported that Lubricity was a better remedy for their dry mouth symptom compared to the products they were currently using. How does Lubricity work? It forms a mechanical gel-like coating in your mouth to provide symptomatic relief by providing moisture and lubricity. sorry. Lubricity lubricates the mouth and brings about comfort from symptomatic dry mouth, eventually leading to good quality sleep and improved quality of life. The sodium hyaluronate or hyaluronic acid in lubricity binds with the proteins and proteoglycans present in the buccal mucosa. The resulting interpenetrating chain-like structure readily absorbs water and brings about long-lasting moisturization and lubrication. 1 gram of hyaluronic acid can retain up to 6 liters of water. Sodium hyaluronate is also resistant to desiccation and therefore can provide up to 4 hours of symptomatic relief, compared to the 30 minutes of moisturizing effect provided by normal human saliva. Sodium hyaluronate also enters the extracellular matrix and is retained by the epidermal layer of the buccal mucosa. The lower coefficient of friction provided by sodium hyaluronate provides the high efficacy attributed to lubricity. Consistent use ensures that the efficacy is improved over time and provides increased quality of life from dry mouth. The lubricity is made from a simple 5-ingredient formulation, namely hyaluronic acid as the active ingredient, xylitol, and a preservative system. What sets us apart from all other dry mouth remedies is the hyaluronic acid that we utilize in our formulation. Hyaluronic acid is termed nature's lubricant. It's commonly available in our synovial fluid in articulating cartilages and other connective tissue. Some features of lubricity: it's odorless, tasteless, and it's a simple gel-like consistency, very similar to human saliva. We use the rule of 4s when it comes to lubricity. We recommend 4 pumps per use, 4 times a day, which is after meals and before sleep, for providing 4 hours of relief. Lubricity is safe to be used for patients with heart disease and diabetes, as lubricity is a 0-calorie product and it does not contain sugar, and the permissible limits for sodium and potassium are well below the daily requirements. Some nutritional facts about lubricity: as I said, it's a 0-calorie product. It has no gluten, no alcohol, and no sugar. And we use hyaluronic acid, which is naturally available in our body. All ingredients in lubricity are GRAS listed by the FDA, eventually leading to good dental hygiene. And I'm going to turn over to Danny to conclude our presentation.
Thank you, Dr. Pereira. So there are a number of dentists throughout the country that have lubricity in their practice. They actually stock it to have it readily available for their patients who need it. And just based on what the price point is of lubricity, the MSRP versus what your purchase price is, the profit margin is actually between 40 and 60%. Well, it's relatively high. It could be actually a little profit center for you in your dental practice. And just for attending our webinar today, we're offering an even more special deal where you have the opportunity to receive 45% off your entire order by using this coupon code that's on the screen, 450-450FF, 45 off at checkout. And this is valid until July 31st. So with that, I would like to now open it up for any questions that any of you might have. Okay, so here's our contact information on the screen. Feel free to reach out if you have any questions, if you think of any questions afterwards, or if you want to share any comments with us. We would love to hear from you. So with that, I want to thank you very much again for attending this webinar. So again, the code for the this 45% off special is 450FF. 450FF, 45 off. Thanks again, everyone, for attending. Have a great rest of the day.